This message is for you, wherever you are. It will help introduce the science of chiropractic to you. If you are listening to this recording at home, call in your friends and neighbors to listen with you, for this message is of vital importance to everyone. Chiropractic helps the sick get well, and everyone should know it. Your doctor has made this recording available to you and your family and friends because he has dedicated his life to getting sick people well. No one likes the first visit to a doctor. There are too many unanswered questions in a sick person's mind on that first visit. What will the doctor be like? What questions will he ask? What will he want me to do? Will he find the cause of my trouble? If he does, will he be able to help me? And if he can help me, can I afford it? Those and questions like them exist in the minds of all of us on the first visit to the doctor. The confusion you may feel about the first visit to your doctor of chiropractic will be cleared away in the next few minutes. Chiropractic educational standards are high. All accredited chiropractic colleges require more than 4,000 hours of study before graduation. There is intensive study in courses in anatomy, physiology, chemistry, bacteriology, obstetrics, and related subjects. From the beginning of his college training, your chiropractor was gaining first-hand experience in adjusting the sick. At first, he did little but observe, but as his knowledge increased, he worked more and more with patients. By the time he graduated, he had successfully managed many cases entirely by himself. Yes, chiropractic standards are high, and you may place every confidence in your chiropractor. Everyone knows that chiropractic is effective in backache, stiff neck, neuritis, arthritis, and sciatica, but not everyone knows that chiropractic is equally effective in conditions involving the internal organs. Whatever your trouble may be, plan a visit now to your chiropractor. Let him determine whether he can help you. Your chiropractor will take a thorough case history on your first visit, and he will examine your spine to determine the cause of your trouble. Often, X-ray pictures are required. These give the doctor specific knowledge of the bone structure of your body. They tell him if there is any arthritis or bone tumors. The pictures also give him knowledge of the exact position of the spinal bones that may be impinging nerves. An impinged or pinched nerve is unable to carry nerve energy to the internal organs, and this may be the cause of your trouble. In certain conditions, he will make tests of your blood and urine. When necessary, these tests give important information to your doctor. After the examination, when all facts have been assembled, your doctor will report his findings and tell you whether he will accept you as a patient. If the facts convince him that your condition can be corrected by chiropractic adjustments, he will outline a program for you to follow. Your chiropractor is a specialist who deals with the spine and nerves. He knows, and he wants you to know, that the same nerve energy that heals broken bones, heals wounds, and digests foods can make you well, provided it is allowed to flow freely throughout your body without interference. When an impinged nerve is released through a chiropractic adjustment, this vital nerve energy can return the affected organ to its normal function. The chiropractic adjustment is a painless, almost pleasant manipulation of the spinal bones. No two persons are alike. The time required to regain your health depends upon the ability of your body to respond. That response depends on several things. How old are you? How long have you been sick? How far has your disease progressed? And the most important consideration, will you give your doctor sufficient time, and will you follow his recommendations? His recommendations are based upon his vast experience and the experience of other doctors in similar cases. Some conditions are corrected by a few adjustments. Other conditions may require adjustments over a longer period of time. Follow your chiropractor's recommendations to the letter. He will recommend what is best for you. He wants you to be well as quickly and as economically as possible. Feel free to discuss the question of cost with your doctor. Cost depends upon your needs, how quickly you will respond, how much time is required each time you are in the office, and how many times you will have to be there. Your chiropractor wants you to be well and will help you make financial arrangements for the necessary care. More than 500 insurance companies have provisions for chiropractic in their policies. You may have an insurance policy that covers chiropractic care. Take your policy to your chiropractor and let him evaluate it. Here are some examples of typical results chiropractors get every day. In every case, the patient followed the recommendations of the chiropractor. Mr. Horner, a middle-aged businessman, considered himself healthy, and he carried all the outward signs of health. But one day, while bent over his desk, he noticed a bit of dizziness. This occurred only once that day, and he soon forgot about it. In the days that followed, he experienced frequently moments of dizziness, and each time he accused an upset stomach and took something for it. Soon he began to complain of tiredness and headaches. Some days he would awake exhausted, and he would go to the office late and leave early. And Mr. Horner was like many of us who have been healthy all of our lives. He put off going to the doctor. His business partner had just completed a successful series of adjustments for a liver disorder and eventually persuaded Mr. Horner to see a chiropractor. The chiropractic examination revealed that Mr. Horner was suffering from dangerously high blood pressure resulting from an impinged nerve. During times of physical exertion, business stress, or emotional upheaval, his blood pressure might soar high enough to put his life in jeopardy. Fortunately, the condition had not yet damaged any organ. Under the chiropractor's care, Mr. Horner's blood pressure soon stayed within normal range at all times. His recovery was complete, and he is still an active partner in the same business firm and a healthy, happy man. Here is another example. Just 1 year ago, Mrs. Miller, 68 years old, was miserable. Today she is a smiling, happy woman enjoying her best years of health. But a year ago, her complaints were many. She felt tired and weak. She suffered from nausea, vomiting, and pounding headaches. She sought relief from many doctors who diagnosed her symptoms as stomach ulcer and treated her for that condition. She got some relief from drinking milk, but her condition gradually worsened. She was referred to a chiropractor by her next-door neighbor who had been helped by chiropractic. During the first consultation, when the chiropractor was seeking information for the case history, Mrs. Miller mentioned a fall she had taken many years ago. The chiropractor made a thorough examination, including X-ray pictures of the spinal column. He assembled the facts and reported to Mrs. Miller that one of the bones in her spine was out of place, probably the result of her fall. He explained that this displaced bone was blocking the nerve supply to her stomach. This was the cause of her stomach ulcer. Mrs. Miller was quick to understand the cause of her condition, and the chiropractor outlined a program of adjustments. She followed exactly the program he recommended and made a quick, full recovery. She now sees her chiropractor only for regular checkups. And now listen to the story of Mary. She was a typical, happy student in a beauty college. One morning, while driving to school with a group of students, she was discussing the forthcoming graduation. Suddenly, from out of nowhere, a car appeared in front of them, and there was a grinding crash. The sudden stop caused Mary's head to whip forward, then backward. This is commonly known as whiplash. Soon, severe pain in the neck and shoulders appeared, and she complained of blurred vision and severe headache. These symptoms persisted for several days, even though she remained in bed. Finally, when numbness developed in her arms, her insurance agent insisted that she visit a chiropractor. As is typical in so many accidents on the job and in cars, this sudden, violent injury had caused some of the spinal bones to become misaligned. There was damage to nerves where the bones were pressing upon them, muscles were torn, and ligaments damaged. Fortunately for Mary, these bones were adjusted by the chiropractor. After the damaged muscles and ligaments healed, she returned to her studies and is now operating her own beauty shop. The last example begins several years ago. 4-year-old Jimmy had been suffering for months with an acute weeping skin disorder commonly known as eczema. He had been examined and treated in several clinics in several states. Hundreds of skin tests had been made for allergies. Everyone had agreed on the name of his condition, but no one had been able to find the cause or help him. Among other things, he had been put on a strict diet of rice flour, yet his condition had become steadily worse. In desperation, as a last resort, Jimmy's frantic parents took him to a chiropractor. The little boy wore a T-shirt his first visit. Because of the weeping skin, his arms were bandaged from the shoulders to the wrists, and his knees were also wrapped. The chiropractor determined that Jimmy could be helped by chiropractic care. The cause of this little boy's weeping skin disorder was in the spine. Nerves passing between several vertebrae were impinged and unable to carry nerve energy to the organs controlling elimination. The result of this multiple impingement was weeping skin. The chiropractor explained to the parents that this condition could be corrected by chiropractic adjustments, but though they wanted to believe, they found it difficult. The father said, "We don't believe in this, but we promise to cooperate fully because we know of nothing else to do." Jimmy began taking chiropractic adjustments, and soon his parents were amazed and delighted to see their little boy's skin begin to return to its normal condition. He improved rapidly and made a full recovery. All of that happened some years ago. Jimmy is now a young man, 6 feet 2 inches tall, and a star high school basketball player. Through the years, his parents have referred many friends to chiropractic. These are only a few typical examples of what chiropractic can do for injuries and illness. Only a chiropractor can determine what chiropractic can do for you. If you are sick, go to a chiropractor. If you know someone who is sick, send him to a chiropractor. Health can be yours through chiropractic.